This is Maui Community College, with a world of knowledge here at home.
So this is the old Tiki eyes. It's also called the Occulomotor assessment. So when you're assessing someone's eyes, first thing I look for is pupil symmetry. And here our pupils are equally round. Anisocoria means unequal pupils. And slight anisocoria is a normal variant in 25% of the population. And without iso, the same, choria, pupils. That's where anisocoria comes from. So slightly unequal pupils is normal in 25% of the population. Size is measured. We can use little charts with the spots that tell us whether it's 1 millimeter, 2 millimeters, all the way up to 10 millimeters. That's usually enough. And so when we look at pupil size, we look at symmetry and we measure. I like to throw this in. Pinpoint pupils. Pinpoint pupils, people on the effects of narcotics, opioid analgesics, can have pinpoint pupils. Parasympathetic nerve fibers from cranial nerve 3, the oculomotor nerve, provide the innervations for pupillary constriction. And if you go to the movie theater, all during the movie part before the Roman numerals come up at the end, but all during the movie, if you look at the Hollywood actors very, very carefully, you'll see that sometimes some of them have pinpoint pupils all the time. I wonder why. A blown pupil, that's what we used to call it. A blown pupil is a single dilated pupil, and it can be a sign of neurologic distress, trauma, swelling of the brain, bleeding around the brain, stroke, anything that's either going to shift the brain and stretch the third cranial nerve can result in a blown pupil. But history is everything, because maybe they just went to the eye doctor today and got their pupil dilated for an exam. So history is everything in these types of exams, all exams. So at the bottom is my hand with a flashlight, a little pen light, shine it in people's eyes. And here we see fixed and dilated pupils. Fixed meaning they don't move, dilated meaning they're open. And fixed and dilated pupils means severe brain damage. This is a normal light reflex. Notice when the light comes on, both pupils are going to respond. And so the pupil that responds, that's the direct light reflex. And the other pupil is going to constrict as well in response to the light, and that's the indirect or consensual light reflex. And we can move to the flashlight to the other eye and see the same thing happen. The direct response occurs when the light is shined in that pupil. The indirect response is the other pupil responding to the light reflex. The indirect response is also called the consensual response. Symmetric direct and indirect pupillary reflexes reveal an enormous amount of information about the reflexes inside the brain stem. And that's why we do that. Just that test alone tells us an enormous amount of information about the brain stem, as long as you know how it's wired. But shining the light in the eyes and seeing that both pupils respond equally is more than enough. We hear about accommodation. I'm not sure anybody really knows what accommodation is. Accommodation was originally developed to detect tertiary syphilis. We'll talk about that later. That's a sexually transmitted disease. Modern antibiotic use has made tertiary syphilis very rare, but the eye exam for accommodation remains. Accommodation is more than just crossing the eyes. Crossing the eyes is called a convergent gaze. Accommodation is actually the pupillary reflex that occurs when focusing close. Actually, the whole thing is accommodation, but one of the most important parts of accommodation is that as the eyes focus close, the pupils get smaller. And this doesn't have anything to do with crossing the eyes, because we can test absolute accommodation. If we cover one of the eyes as the open eye focuses on something more close, the pupil gets smaller. So this is absolute accommodation. So those of you in the clinical setting will see P-E-R-R-L-A, pupils equally round, pupils equally round and reactive to light. And the A stands for accommodation. And if you're not going to do accommodation, then I don't even put the A at the end. But I do positive, negative, and absolute accommodation when I do accommodation reflexes. So this is a normal conjugate gaze. Conjugate means yoked together, moving together. Normal gaze. Eyes that move together are going to be able to maintain a single image as they track. And so this is called gaze, a conjugate gaze system. So I showed you conjugate gaze when the eyes move together. This is disconjugate gaze. And so new onset disconjugate gaze can be a serious neurologic problem. So always ask if they're having double vision. Something I do, something many people do, is if you look carefully, you can look at someone else or in the mirror, you can use the reflection off of their eyes as a landmark to make sure that the pupils move around that gleam in their eyes symmetrically. And here you can tell that the eye on the left does not move symmetrically with the eye on the right, and that makes it more obvious when we're looking at the gleam. Nystagmus, for lack of a better description, is like eye tremors. Nystagmus, which is a type of eye tremor, has many causes: drugs, dizziness, but this can also be a sign of cerebellar dysfunction, dysfunction of the cerebellum, part in the back of your brain that's also involved in balance. And so this is nystagmus. It's not a great animation of nystagmus, but if you see this, that's what it is. Something else to keep in mind are something called the oculovestibular reflexes. Oculo meaning eyes, vestibular is head movement. The vestibular system senses your head moving through space. That's why if you close your eyes and spin in a chair, and the chair stops, you still feel dizzy. That's your vestibular system that makes you feel that way. And the eyes and your ear balance system, your vestibular system, are closely related to each other. If you look in the mirror or at the person next to you and bobble your head around slowly, you'll notice that your eyes can stay fixed on a certain point as your head moves about. And this is because the oculomotor system is closely connected to your vestibular system. I want you to know what a saccade is. A saccade is an instant gaze change. As you look from one place to another, the vision centers in your brain will burst off. They'll shut off as your eyes move and come back on. And so that's different than gaze when you're following something with your eyes. A saccade is an instantaneous gaze change, like here and back. That's a saccade. Ptosis is eyelid droop. Your oculomotor system is designed to keep your pupils, keep your eyelids above your pupils. And so a single eyelid that droops over the pupil is ptosis. And this can reveal a neurologic problem, probably in the brainstem. Ptosis is usually accompanied by other signs of weakness as well. And so anyway, that's Tiki eyes. That's my